Gary was amazing. He was just magnificent. He was just a great guy. He was everything to me. We went to the neurologist, and the neurologist, in talking to Gary, noticed that his arm was just twitching, and he asked him, "Gary, how long has that been going on?" And Gary goes, "You know, I guess, I don't know, a couple months." And he said, "You know, I'm going to send you to talk to someone up at OHSU." Gary, being a baseball player in his youth, definitely knew who Lou Gehrig's was, but we really didn't have any idea what the disease was. He was diagnosed in '93.
Patients with ALS would get diagnosed usually by a neurologist and frankly told, you've got a terminal disease, you're likely to die in 2 to 4 years, a little less, a little more, get your affairs in order.
Families were very much sort of adrift on their own, looking for resources. There wasn't a central place that people could go for direction, support, and guidance in terms of accessing quality health care, in terms of where to find community resources. People had to figure that stuff out on their own.
It was a very lonely journey. There wasn't really any support groups or anyone that understood the disease. Gary died in 1995.
Let's take it apart piece by piece and put it back on.
We say not just one person has ALS, the entire family has ALS. People are faced with huge life decision questions. Do I continue working? What am I going to do financially? What about my kids? Do we have the resources we need?
The loaner closet has been very helpful. This disease can progress faster than what you can get the equipment you need, so the closet is there to fill the gap.
Actually, I would say they were helping us with the need, maybe even before we really needed it.
Our role is to meet people where they're at, to essentially come sit next to someone who's newly diagnosed, help them understand the disease, their diagnosis, their management choices, as well as get a sense of the resources they may need to cope and live with ALS. We really focus on living with ALS. We want to empower people to be independent and to live a good life with the disease. When we first started the ALS Association, Cindy Burdell, who was our founding director, took a leap of faith and quit her job, and working with a seed loan from the National ALS Association of $50,000, launched our first Walk to Defeat ALS. She did it out of a commitment and passion to make a difference for families living with ALS because it was in her heart. In the last 10 years, the ALS Association has served over 750 families living with ALS. We've founded 6 support groups across Oregon and Southwest Washington that weren't there before. One of our main accomplishments is our partnership with the Providence ALS Center. When we walk into the room with a newly diagnosed family, all of our supporters and all of our donors are there with us because people out there have said, we want to make a difference for ALS. People aren't alone now because of the ALS Association.
To deal with it day in, day out, they know exactly what this disease is all about.
We really depend on the ALS Association. Yeah. And we know they won't let us down.